Doctors and health professionals nationwide are experiencing a dire shortage of a crucial tool used in hospitals all around the world, medical imaging dye. It's prompting doctors to reserve supplies for life or death matters, and even worse, for patients, postpone procedures until further notice. The dye is widely used in CT and MRI scans, helping doctors diagnose a multitude of things like a brain bleed or a tumor. So joining us now is Dr. Jeff Rubin, Clinical Service Chief of Medical Imaging. Dr. Rubin, thank you so much for joining us.
My pleasure.
All right, so we're talking about yet another shortage here. How does this affect reading results when it comes to quality and optimal imaging?
So fortunately, radiologists have a number of tools in their toolkit to perform imaging and to figure out what's wrong with folks when they're not feeling well. And in this instance, the shortage of iodinated contrast material is akin to having a photograph that's in black and white as opposed to color. We can still use CT scanning to see many things, but some of the things that are really dependent on those color differences require us to use other tools such as ultrasound or MRI. And in many respects, just the preparation and the awareness that we have this shortage in the contrast material coming has allowed us to prepare and to assure that we're taking care of patients in the best way possible.
Well, that's certainly great news. You know, the preparation certainly makes a difference. You know, you're talking a lot about nuance there, black and white versus something in color. But what harm could patients experience, you know, especially those who really need to get a procedure done if that procedure is in fact postponed?
So for the most part, procedures shouldn't need to be postponed. In our hospital, as well as in hospitals around the country, the priority is placed on the most urgent problems and assuring that people that need to have the contrast enhanced studies will have that. There isn't a complete cessation in the availability of the contrast material. It is just a reduction in availability. And so it's causing us to think a little bit clearly and twice about who should receive it first, but anybody who is in a dire circumstance should not be restricted from receiving it.
I like that, and I like that you are reiterating that as well, Dr. Rubin. Okay, if this shortage does persist, let's say, past the summer, you know, what are some potential long-term effects here?
Well, the good news is that the factory that had shut down that was responsible for producing the contrast material is already back online. And this was a result of a transient COVID surge in China. And so we're told that we can expect this to last for 8 weeks and no longer.
All right, and the preparations have already been done. Dr. Jeff Rubin with some good news this evening. We appreciate that. Thank you so much.
Thank you.
Right after the break, we bring in. Thank you for watching. Click the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.